Urology is a specialism which has used a variety of nurse-led clinics to meet patient needs in the United Kingdom. Bruce Turner is a Uro-Oncology nurse practitioner. He talked to nurseledclinics.com about setting up and running a variety of urology-based clinics.
Thanks very much for being interviewed, Bruce, for the website. I wonder if you could tell us all, what are the clinics that you run?
My clinics are mainly Uro-Oncology clinics, so patients with urological cancers. I primarily deal with patients with prostate cancer and different clinics throughout different stages of the patient pathway. I run a nurse-led prostate biopsy clinic, and patients come back to me for the results of their biopsies. And I run a prostate cancer follow-up clinic for urology patients, or for a urologist, and for an oncologist, so patients undergoing surgery or radiological treatments, radiotherapy treatments for their prostate cancer. I also run a telephone follow-up clinic for stable prostate cancer patients who we have shared care between the community and the hospital. I also run a hematuria clinic for patients being investigated for bladder cancer, and intravesical therapies for treatments for patients who have bladder cancer.
I wondered, Bruce, if you could tell us how these clinics came to be set up.
Yeah, the clinics developed as I developed within my post. When I initially started, there were no oncology or Uro-Oncology nurse-led services in place. I worked with a colleague who leads on benign urological disease, and she'd set up lots of clinics in her area, but the oncology side of things was lacking. So as I developed within my post, we assessed what needs there were for the patients, and a lot of the service developed through cancer targets, through the Department of Health cancer targets, and really to help ensure that we were able to meet these targets, so that we weren't penalised from a cancer diagnosis point of view. Also, things such as patient satisfaction surveys helped us build the case for nurse-led services, and visiting other departments to see what other colleagues were doing around the country. That was quite a big influence. But really, I think the drive is the relationship that you have between your colleagues, your medical colleagues, and you as an individual, as to what areas you wish to develop into a more nurse-led service. Some of the areas, although it is a nurse-led service, really I suppose the correct terminology would be perhaps consultant-led, nurse-administered clinic, because usually there's overall responsibility would lie with the consultant, and I think that's important because it does give you the opportunity to be able to ask a question or to check something if it's not right, but also if you feel unable to deal with a particular situation, there's a fallback, and I think that's important for us as nurses. But also I think it's important to recognise that we can lead in some areas and make a difference for our patients.
So what advice would you give, Bruce, for people setting up nurse-led clinics, maybe in urology, but maybe in other areas as well? Any tips or issues that came up for you that perhaps people could reflect on and perhaps not wouldn't say made mistakes, but could learn from?
I think the most important thing is to realise that it's a team effort, that we are multi-professional work. We do work in a multi-professional environment, and it's important that we continue the relationships between colleagues, medical colleagues and other nursing colleagues. I think it's important to recognise that these clinics do take time. It's also, I think, important to recognise that if a nurse is providing a service, that service needs to be given to the same level of competence as a medical practitioner. And I think one's own development and competence I think it's important to recognise that one's own competence is... What am I trying to say? That you have to be competent, basically.
Right.
One has to be competent then.
I think it's important... Yeah. I think it's important to recognise that one does need to be competent and proficient in the area in which one works before embarking on providing a nurse-led service. I also think it's important to realise or to recognise that these clinics do take a long time to set up. Policies have to be written. The policies should really reflect what the nurse is providing or the service being provided by the nurse. And I think it's important to take time at the beginning to ensure that the policy is written in a way that protects the nurse should there be a problem later on, but also to be used as a framework in which the nurse has the ability to accept or not accept patients within that service, because I think sometimes it can be seen sometimes as an extra clinic, and this is an extra place to put patients who need to be seen within a certain amount of time to help meet targets.
Do you mean devoid of whether the service is the right service for them?
Yeah, whether it, exactly.
Yeah.
You know, sometimes it could be seen that this is a clinic, let's put this patient in, but clearly it's inappropriate for a patient, for example, with prostate cancer to be seen in a bladder cancer clinic or a hematuria clinic simply because it's a slot available.
Yeah.
And I think the policy for the individual clinic does help the nurse to be able to enforce what needs to be seen in that clinic and maybe what doesn't. I think it's also important to recognise that getting services set up takes time. That you need. I think it's important from the start to ensure that there's the admin support, so that there's someone to be able to collect the notes, that the clinic clerk is able to ensure that the notes are at the clinic on a given time. And I also think it's important to ensure there's secretarial support. I think the nurse-led service should be administered in exactly the same way as a doctor-led service, and the majority of clinical nurse specialists or nurse practitioners in this day and age within the NHS are constantly reminded of the fact that their job is clinically focused, and I think it's important that we recognise that if we are writing letters or spending time writing letters rather than seeing patients, that it has in some areas left people open to criticism or left people open to being questioned about how much time they actually spend in a clinical role.
And finally, Bruce, I wondered if you had any take-home tips for anyone setting up a nurse-led clinic in urology or in any other discipline.
I think my main tips would be to try to find out what's already been done in other organisations. Speak to colleagues, take the time to network to ensure that there is a service need. Question colleagues or peers as to what they found beneficial in setting up services, how they've managed to set up services, trying not to reinvent the wheel, asking colleagues to share policies with you, taking the time to read professional guidelines from the professional organisations and implementing those into the clinics. I think it's important to acknowledge that these things do take time. One can be left despondent at times, but perseverance often pays off, and that usually is shown in patient satisfaction surveys with nurse-led services. I think apart from that, really, there's not much else to add.
Great, thank you for talking to us, Bruce.
You're welcome.